So, dual diagnosis treatment, what does this mean? How do you know which is the best route to go for you, whether it's mental health or addiction? Well, if we start to look at your past, what had to happen for you to begin to use, to sedate, to numb out, to self medicate, whatever that looks like for you? And again, in the early stages, we want to remove the guilt and the shame. If you're currently experiencing guilt and shame, this is part of the cycle that we can help you break. But for this conversation, I just want to keep it very, very topical on this dual diagnosis, which co-occurring mental health, addiction disorders. So here's what we found. We're coming up on 25 years, so a quarter of a century of doing this. We have doctors, therapists, psychologists, nurses. We have a great team that's able to help you through this. But what we found is, and not always doing these videos, I have to hit kind of the more mainstream and answer questions more at a larger level. So understanding that as we jump into it, most often what happens is there is something, either a traumatic event or there's a brain or chemical imbalance. And so the individual wanting to change, not knowing how to utilize different tools to change, will look for substances in order to change the brain chemistry. Once this becomes something that we actively do again and again and again, addictions are formed. And now we're stuck in this well, basically this path of destruction. So the first thing we want to do is we want to stop whatever we're self-medicating with. We want to go ahead and stop that. So we look at the addiction portion first. Once we can get off the physical aspect of whatever it is that we are looking to use to change our states, we get enough time off. Now the core issue begins to become exposed. So think of it like this. If I have a cut and it's infected, but I just put a Band-Aid on it, I don't see it, it's still infected, but I just go ahead and I keep anesthetizing it, meaning I don't really feel too much pain. It doesn't mean the cut isn't there. It doesn't mean the bacteria is no longer in there. It just means I covered it up and I don't necessarily feel it. So if I remove the Band-Aid, I now expose it to the elements. And if I stop using the cream or whatever it is that numbs the pain, now the pain is going to feel much worse than before. Doesn't mean it is, but it just means I've numbed it. Now it's exposed. Now we can deal with the actual issue to clean everything up, to get rid of the bacteria, to go ahead and allow the skin to regenerate. It's a really crappy analogy. I apologize. But I'm hopeful you'll get it, where once we can remove the addiction portion, the actual physical part of sedating, of self-medicating, now we can start to identify, okay, is this because of trauma? Is it because of brain chemistry, dysregulation? There's a lot of different issues. Now we can look at more of the mental health side to get to the core issue, to actually do the work to help this issue heal. And now as a organic byproduct, like I have scars here, I don't have to numb the pain anymore. I don't have to have a Band-Aid. In fact, actually, it's very tough skin now and can take on a lot more than my other skin. So the reason I want to explain this is because a lot of times people say, well, I don't know which one is the right one. Is it mental health or is it addiction only? Is it dual diagnosis? In the beginning, just get help. Like just get help to become a little bit more stable with the physical modality gone. And then from there, you'll be able to expose of this really is more mental health driven. I want to be able to find what type of medication will actually help me to help stabilize and bring to a healthy level of different levels so I can experience life at a more stabilized place. So hopefully that answers your question. If not, let us know and we'll just keep tackling these questions.